This special report is brought to you by Ashton Robinson of Mercer University. The county described in this report is Wilkinson County, one of Central Georgia's rural counties. Wilkinson County is filled with rich history. The county is named for General James Wilkinson, a general of the Revolutionary War, who oversaw the land negotiations with the Creek Indians in 1803 that established the county. This rural county's main industry is kaolin mining. However, agriculture also takes place here. This historic county is 58.8% white, 40.7% black, and 1.7% Hispanic. Unfortunately, many minority health disparities still exist in Wilkinson County. According to the Georgia Health Disparities Report, black-white inequalities in health outcomes in Wilkinson County resulted in 11 years of potential life lost. The unemployment rate in Wilkinson County has consistently stayed above the state unemployment rate. Also, the median household income is significantly lower than the state average. Additionally, the number of children in poverty is at a higher percentage in Wilkinson County, with the rate of 33% compared to the state's 25%. The health disparities examined here include low socioeconomic status, birth outcomes, and access to care. Socioeconomic status is intertwined into health outcomes, for race and socioeconomic status are strongly correlated. This county struggles with poverty, and according to the Georgia Minority Health Report, 27.9% of Wilkinson County African Americans live below the poverty level. Education is a large contributing factor to socioeconomic status. In Wilkinson County, only 48% of the population graduate from high school, and 15% have some college. The CDC's Health Disparities and Inequalities Report states that people with the lowest education levels and income most commonly are the populations that exhibit the poorest health. Low birth rate, which is defined as a birth weighing less than 2,500 grams, is an important predictor for population health. Low birth rates have remained stable in white women, but have been increasing in African Americans. One contributing factor to this health disparity is inadequate prenatal care. There are no obstetricians or gynecologists in Wilkinson County. Furthermore, there is no hospital. 11.3% of births in Wilkinson County were considered low birth weight, compared to the state's 9.5%. Additionally, the low birth weight percentage for African Americans from 2007 to 2011 was 18%, whereas for whites, it was 7%. The entirety of Wilkinson County is a health professional shortage area. A health professional shortage area is defined as a shortage of primary medical care, dental, or mental health providers. Furthermore, there is also a lack of health professional diversity in the area. Another factor related to access to care is the availability of physicians. The ratio of physicians to the population in Wilkinson County is 1 to 9,577. Also, insurance rates are predictive of use of health care and health outcomes. In Wilkinson County, 20% of the population was uninsured in 2010. Policies targeting education, income, and health care would be beneficial for this county. Education policies that could be used include those that encourage more years of schooling and target youth, such as Head Start. Economic policies can also be useful. These policies include redistributive policies, which reduce income disparities, and policies to affect the labor market. Furthermore, interventions in the community designed to increase knowledge would have beneficial impacts on prenatal care and, in turn, low birth weight. Additionally, ensuring that the built environment has social support structures like community centers and churches is another way that health can be affected. Increasing the availability of healthy foods at small local stores can affect low birth weight by increasing the nutrition of the mother. Finally, the availability of primary care within the county is tantamount to reducing health access disparities. Health disparities still exist in communities both rural and urban. These disparities impact the health status and well-being of the individuals who live in these communities. Wilkinson County is rich with history and has much to offer. Health disparities in this community can be addressed as long as there is advocacy for change and public health professionals are willing to put in enough effort. This concludes the report of the health disparities in Wilkinson County. I encourage viewers to use the information from this presentation to enact change in Wilkinson County as well as their own communities.